Welcome back. In this module, we're going to talk about brain behavior systems, and we're going to look at the functions, problems, and solutions. It's this module that really provides the foundation for the method. You can find more information about it in the atlas that we produce at Amen Clinics, Images of Human Behavior, or in my book, Change Your Brain, Change Your Life. So what we're going to do is we're going to look at different parts of the brain. We're going to look at what they do, what happens when things go wrong, and how to fix it. So we'll look at the left versus right hemisphere, male versus female. We actually did this huge study. We'll look at the prefrontal cortex, cingulate gyrus, basal ganglia, insular cortex, temporal lobes, the deep limbic part of the brain, and an area of the brain most people never talk about when it comes to behavior, which is the cerebellum. So the left side tends to, the brain is obviously one integrated organ, but the left hemisphere is the more detailed part of the brain. It actually has more cells. The cells are more packed tightly together. The right side sees the forest, so it gets the gestalt or the big picture of the thing, obviously connected by big fiber tract bundles in the corpus callosum. The left hemisphere, and a lot of this comes from Fred Schiffer's book. Fred's from Harvard. He has a book called Of Two Minds. Is more logical, precise, detail-oriented. It's involved with language and communication. It worries about time. It's happier and more positive and tends not to see problems, which is interesting when there's do a treatment called TMS, transcranial magnetic stimulation. For depression, they're stimulating the left front side of the brain because they want to get it more activity to help treat depression. The right hemisphere sees the big picture. It sees the forest. It tends to be more creative and artistic. It can put together a room. But the right side is very interesting. It tends to be more anxious, fearful, negative. It tends to focus on problems, admits to problems, and operates on hunches. It becomes very important when you think of the differences between the male and female brains. This is a study we did at Amen Clinics where we compared 46,000 scans on males and females, and what we found is that the female brain was more active in a large percentage of the brain. So where yellow and red are, that's more active in females, and white is neutral, and blue and light blue are more active in males. So males had parts of the cerebellum more active, females were more active nearly everywhere else. That is actually really interesting. I wrote a book called Unleash the Power of the Female Brain. Based on that study, we found females had 5 consistent strengths: empathy, intuition, collaboration, self-control, and something that I think of as a strength, but a lot of people don't, is appropriate worry. If we go back, and if you look at the cingulate part of the brain, so the cingulate part of the brain is right here. So let's see where, if you look at the top right image, this red, it's the brain's gear shifter. It allows you to go from thought to thought, move from idea to idea, be flexible, go with the flow. If that works too hard, people can be worried and rigid and inflexible, and if things don't go their way, they can get upset. But the benefit is appropriate worry keeps your behavior more appropriate. So for example, did you know that women go to jail 14 times less than males? Because they tend to have better self-control and worry. So empathy and self-control are frontal lobe functions. Intuition, right hemisphere function. Collaboration is a limbic function. All of those areas more active in females. So the don't worry, be happy people, more often men on motorcycles, die the earliest from accidents or prevent. And it tends to be more male. So, but if we look at the vulnerabilities of the female brain because of the increased activity, anxiety, depression, insomnia, eating disorders, pain, and having trouble turning off their thoughts. So women have anxiety and depression twice as much as men. 23% of women between the ages of 20 and 60 are currently taking antidepressant medication. Now, I actually think that's sort of nuts, that there are natural ways to help. But isn't it interesting? Women tend to respond more to SSRIs. Why? SSRIs are calming to the brain. SSRIs decrease blood flow and function in the cingulate gyrus and the frontal lobes. Men tend to not be as responsive to it. So men have more total number of neurons than women. It's about 10% even when you correct for size. But women have more total number of dendritic connection. So it's like men have more gray matter, women have more white matter. The corpus callosum in a number of studies have been found to be larger in women, allowing greater access to both sides. Men tend to be more left-sided in their approach to life. Women tend to use both sides of their brain more often. The limbic system is larger in females. We're going to talk about a lot about the limbic system. It's involved in bonding. Women are the primary caretakers for children and the elderly. Bonding tends to be easier for females. Women also have a larger nesting instinct, so they tend to be primary caretakers for the house. This is very important. I was an Army psychiatrist for 7 years. When couples moved in the military, women tended to get depressed much more than the men because they lost their nest. So when you move, it's really important to help get the house put together and settled so she feels comfortable. She's more likely to do better than if you just come and go to work and let her fend for the kids and herself. Women have a greater incidence of depression. In fact, depression is the #1 reason for hospitalization. Women between the ages of 18 to 44 after having a baby. The inferior parietal lobe, so the lower part of the parietal lobe, larger in men, especially on the left side. So it estimates time, judges speed, visualizes objects in 3D like catching a football, and is involved in solving math problems. It also gets you from point A to point B. So a man may be better at directions, but a woman is much better at knowing when she's lost. So let's move to the prefrontal cortex, just hugely important. In psychiatry and mental health, it's the most evolved part of the brain. It's 30% of the human brain, 11% of the chimpanzee brain, 7% of your dog's brain, unless your dog is Fraser, only maybe 4%, and then 3% of the cat's brain and 1% of the mouse's brain. Cats have no forethought, they have no judgment, they totally live in the moment. You want a big prefrontal cortex. It's the brain's supervisor, it watches you. There are a number of different parts to it. There's the dorsolateral prefrontal cortex, so that's on the outside of it, and then there's the inferior orbital prefrontal cortex on the underside. So dorsolateral, short-term memory. Inferior orbital is actually part of the limbic system. It's involved in impulse and mood control. I think of the prefrontal cortex as Jiminy Cricket from the movie Pinocchio. You remember Jiminy Cricket was Pinocchio's conscience. Help Pinocchio stay on track to accomplish his goal. That's what your prefrontal cortex does. What was Pinocchio's goal? Was to be a real boy. And when Jiminy Cricket went away, Pinocchio made all sorts of bad decisions. Dudley Moore, the British comedian, once said, the best car safety device is a rear view mirror with a cop in it. Your prefrontal cortex is the cop in your head. It talks to you. It's like, do this, don't do that. If I say this, I'm going to get in trouble. It's called, in the scientific literature, the executive part of the brain. Why? Because it's just very much like the boss at work. It's involved with things like focus, forethought, impulse control, organization, planning, judgment, empathy, insight, and learning from the mistakes that you make. You know people, they make the same mistakes over and over again, then you have to worry about their prefrontal cortex. When there are problems in the prefrontal cortex, people have a lot of bad habits. So I have to apologize for this image. Growing up Catholic, I'm going to Catholic school. I knew one day I would get them back. But anyways, smoking and bad habits. So when there are problems in this part of the brain, for whatever reason, a head injury, toxic exposure, drug abuse, an infection like Lyme, people start acting like cats. How many times I tell this cat, Annabelle, to not drink out of the toilet. So what do you get? Short attention span, impulse control issues, procrastination, disorganization, poor judgment, lack of empathy and insight, and this thing I call brutal honesty. So here's a cartoon. Do you swear to tell the truth, the whole truth, and nothing but the truth? Yes, I do. You could lose a few pounds. So these are people that don't have a good filter on the thoughts that they have. I actually had a friend who was in a car accident in Houston, and she was rear-ended by, she stopped at a light and somebody rear-ended her going 70 miles an hour. And to be with Lisa is to just be with someone who has no filter. And we were at a conference once together sitting in the back, and these two overweight women in front of us were talking about why they were overweight, and one turned to the other and said, I don't know why I'm overweight, I just eat like a bird. And so that everybody could hear, Lisa said, yeah, like a condor. And I looked at her horrified because these women, they got up, they left, they hated us, they were embarrassed. And she goes, oh no, did that get out? So we all have weird, crazy, stupid, sexual, violent thoughts that nobody should ever hear. And when your frontal lobes are hurt, those thoughts tend to get out. People who have low frontal lobe activity also tend to be conflict seeking. It's a way to turn themselves on. So drama driven, they love scary movies, they're starting fights. It's how they get energy and turn themselves on. Now, there are lots of conditions. When we see low activity in the prefrontal cortex, it doesn't mean you have ADD. You might have ADD, but it could be other things as well. So from bad habits like smoking or being obese, ADHD, schizophrenia is associated with low activity in the front part of the brain. Antisocial personality disorder. Adrian Raine at USC published a study, said people with antisocial personality disorder have 10% less volume in the front part of the brain. It's also associated with frontal temporal lobe dementia and certain forms of depression. So here's an example of somebody who has antisocial personality disorder, has a very damaged brain. And if you have a damaged brain, you're going to have a damaged personality. So how do you help this part of the brain? So we're beginning to see the method. So the method is symptoms plus area of the brain that's troubled equals intervention. So we help them with goal setting, because that's what your prefrontal cortex does. It set goals and then helps you match your behavior over time. So we have an exercise we like a lot, we'll talk about, called the one-page miracle. So on one piece of paper, write down what you want. And so when you meet with people, you go, okay, is your behavior getting you what you want? Physical exercise boosts blood flow to the front part of the brain. A higher protein, lower carbohydrate diet helps this because it's a focused diet. It's not good for everybody, it's good for this type. Fish oil, but a very specific form of fish oil called EPA. EPA should be 60% or higher. Brain rehabilitation strategies, stimulating supplements, stimulating medications, neurofeedback, TMS can boost blood flow. It's been shown in repeated studies, and hyperbaric oxygen. We published a study on that in 2011 in soldiers showing increase blood flow, especially to the front part of the brain. When we look at medications to help stimulate the frontal lobes, it really depends on the symptoms we're going after. So if someone presents with ADD or ADHD symptoms, we'll think of Ritalin, Adderall, Dexedrine, Provigil, Nuvigil, Strattera. If they're depressed, we may use Wellbutrin. If they have psychotic issues, we'll use Abilify. From a supplement standpoint, things that increase blood flow, green tea, rhodiola, ginseng, ashwagandha, we actually put those in our focus and energy formula after we did a study on them. But also L-tyrosine, which is the amino acid building block for dopamine, phenylalanine, the amino acid building block for norepinephrine, iron and zinc, because both of them are required to make dopamine. Just an example, what we usually see with ADHD, reasonably healthy at rest, but when they concentrate, it's why at the Amen Clinics we do 2 scans on people, one at rest, one when they concentrate, is what we see is this deactivation pattern, which means the harder they try, the worse it gets. On treatment, we often see significant improvement. Now, if we don't see the improvement, odds are that's not going to be a good medicine or a good supplement for the person. But this is a 15-year-old girl who got a radical improvement in her scan and went from B's and C's working her brains out to straight A's actually for the next 10 years. She got into one of the best veterinarian schools in the world. This is a sex addict that came to see us. And if you look at the top left image, he's got holes in his frontal lobes. And if you look at in that group of 4 to the left, the bottom right image, you can see the damage he has in the top left front side of his brain. He got hit in the head with a baseball bat when he was 10 years old. The scan on the right is with focus and energy in 27 hyperbaric oxygen sessions. So what you can see is we're beginning to heal his brain, and for the last 3 years he's been in a stable, loving relationship with none of the addicted behavior. But if you just put him in a 12-step program and you don't look at or rehabilitate his brain, it's not going to work nearly as effectively as if at the same time you're teaching him how to modify his behavior, you're also optimizing his brain. The next part of the brain is just so interesting. And I have to tell you, I learned not one thing about this in my residency. And I'm a double board certified psychiatrist. I'm board certified in general psychiatry and child and adolescent psychiatry. They didn't talk about the cingulate gyrus at all. But when we started doing imaging, and there's a whole imaging literature on the cingulate gyrus. Think of the cingulate gyrus in 3 parts. There's the posterior cingulate gyrus, so that's here, back toward the back. The middle cingulate, which is here. And then the anterior cingulate. Anterior just means toward the front. The cingulate gyrus runs right on top of the corpus callosum, so that's part of the cortex, right on top of the corpus callosum, or that big white matter fundal fiber that goes between the hemispheres. The posterior cingulate gyrus, very important to remember this. It's the first area that dies in Alzheimer's disease. Even before, because Alzheimer's typically is parietal temporal lobe, hypoperfusion. The posterior cingulate dies first. In fact, in one study from UT Southwestern, they could distinguish Alzheimer's from frontal temporal lobe dementia 95% of the time just by that one spot. The middle cingulate is more involved with feeling your body, especially pain sensations. The anterior cingulate, so toward the front, has the dorsal part on the top, that's involved in thought shifting, and the ventral part, so think of it underneath between your eyes, is involved in emotional shifting. There's actually been research studies that if your ventral cingulate is overactive, it predicts a positive response to an SSRI. It's the work of Helen Mayberg. If it's underactive, it actually predicts a negative response to an SSRI. So I think of the cingulate, especially the anterior cingulate, as the brain's gear shifter. And this was work published by Alan Mirsky when he was at NIH. The anterior cingulate is your gear shifter. It's involved in cognitive flexibility, shifting your attention, going from idea to idea, from thought to thought, seeing your options, going with the flow. It's involved in cooperation, getting outside of your head and into the head of other people. And one really interesting research finding is the cingulate gyrus is involved in error detection. So it tells you when something's wrong. So if I come into the studio and something's out of place, my cingulate gyrus is going, something's out of place. But if it works too hard, you begin to notice errors in other people, in your family, in yourself, and it can be the seed of a lot of trouble. When the cingulate works too hard, usually due to low serotonin levels, the cingulate gyrus is highly innervated with serotonergic neurons. So when serotonin levels go low, cingulate gyrus gets active and people get stuck and worried and rigid. And if things don't go their way, they get upset. They can be obsessive, compulsive, certain types of addictions, not all of them. But what I've seen, they also can be argumentative and oppositional. No matter what it is you say to them, they're arguing with you. In fact, they start arguing with you before you've even gotten the sentence out. And so you see it with patients. It's like, well, I think maybe we should try this. No, I don't want to do that. That won't work. I've already done that. I mean, it's like an automatic, almost reflexive response. And they see too many errors in themselves or in other people. It's like they have a little mouse in their head, and the mouse is on the exercise wheel, and the mouse just can't get off. Same thought, over and over and over. It's one of the classic early imaging findings with OCD, but not all OCD people have it. The OCD people, obsessive compulsive disorder people who have it, tend to respond to the serotonin interventions. These people automatically say no. I don't know if you know anybody like that. My dad was like that. No matter what question you asked him, the answer was no. And he's a wonderful, sweet, normal person, but that was just his mindset. When I finally scanned him at 72, he had the hottest anterior cingulate I'd ever seen in an older person. Road rage, often associated with cingulate problems. If somebody accidentally cuts me off on the highway, I leave it alone. I mean, I might think to myself, you idiot, and then I leave it alone, because there are a lot of crazy people out there. But these people, somebody accidentally cuts them off and they think you jerk, then it circles in their head. It's like you jerk, you jerk, you jerk. And they almost have to do something to get it out of their head. So we'll actually subtype violence. So there's impulsive kinds of violence, low prefrontal cortex activity, and then there are compulsive violence. So cingulate gyrus, where people just can't stop thinking. So we never go murder, what does that look like in the brain? It's what are the types of murderers. And if you know the type, then you can help with the intervention. PMS, this is a woman who actually attacked her husband with a knife like 2 days before the onset of her cycle. Her cingulate is hot. So this view, we're looking down from the top. The bottom is the front part of the brain. The top is the back. So the arrow is pointing to her cingulate gyrus, and you can see the pits in her frontal lobes. So her frontal lobes are low and her cingulate is high. That's not a good sign. And then 10 days later or so, her frontal lobes actually look fine. So this is one of the first times we've seen these views. So blue is average activity. Red or pink, sometimes you'll see it as white, is the top 15%. So it's the most active. In a healthy scan, the cerebellum is the most active part, and in adults, everything else relatively quiet. We'll see in kids, they have busier brains. So, an interesting question. Why does this 17-year-old who has oppositional defiant disorder drink alcohol? Well, one would suggest a calmer brain. Her brain works way too hard. This is a pattern we call the ring of fire. But running right down the middle, sort of like a mohawk, is her cingulate gyrus is just working way too hard. So she drinks as a way to put out the fire in her brain, but because she can't stop thinking about it, and to oppose her parents. So imaging adds very interesting psychodynamic information for our patients. Imaging never diminishes the need for good psychotherapy or good psychodynamic formulation. And so here we have two depressed patients. One of them with no overactivity in the cingulate, the other with high activity in the cingulate. So here we're looking up from the bottom. The top is the front, the bottom is the back. Both of them, you can see lots of red in their cerebellum in the back, bottom part of the brain. One has high limbic activity, but no cingulate. They'll do better with Wellbutrin or the supplement SAMe. The high cingulate people tend to do better with SSRIs or the serotonin supplement alternative, 5-HTP. This is a fascinating case. So this is the first time you've seen a blue, red, and white one. So blue is average activity, red is the top 15%, white is the top 8%. So white are the super hot spots in the brain. And this is an 18-year-old patient who was overweight, who was angry, aggressive, and had to smoke pot every night in order to sleep. And he didn't want to be at the clinic, but he got scanned, and what we saw is cingulate just works so hard, it's like it's almost seizure hot or active. And as I explain the little mouse in his head that would go over and over, I say, oh, you get your mouse stoned at night so you can shut him up so you can go to sleep. So I wrote a blog about it called The Stone Mouse Story. And these images begin to give you an idea of who uses which drugs. So if you have somebody like this, they're not likely to use cocaine and methamphetamine or caffeine. They're more likely to use things like alcohol or marijuana that settle brain activity. So when the cingulate gyrus works too low, there's published research on this, low motivation, they don't talk and they don't move. And usually it's low either because they have a tumor in the area or cyst or they've had a traumatic brain injury. When it works too high, people tend to get stuck. And isn't it interesting, there's so many different psychiatric disorders where people get stuck on things. Certain anxiety disorders, post-traumatic stress disorder, obsessive compulsive spectrum disorders, some eating disorders like anorexia early on, addictions, and people who tend to be oppositional and argumentative. So how do you help them? You raise serotonin. Now, behaviorally, distraction helps. If you get a thought in your head more than 3 times, get up physically and go do something different. You want to give these people options. Never tell them what to do, because as soon as you tell them what to do, they'll want to do the opposite. This is where, when I was in training, there was a form of psychotherapy called reverse psychology, which is basically tell them to do the opposite of what you want them to do. It fell out of favor because it doesn't work for everybody. It works for these people. Exercise helps. Diet helps, but not high protein. High protein is not good for them. DHA fish oil, so not EPA. DHA tends to be more sedating. EPA tends to be more stimulating. And then you can boost serotonin with medications or supplements. And if they're psychotic, we'll use Risperdal or Zyprexa because they tend to have a calming effect on the frontal lobes. So the medications, I think of Prozac and her 6 sisters, Zoloft, Lexapro, Celexa, Paxil, Luvox, and the first one of all of them was Anafranil. But I like supplements for this because they have fewer side effects, especially they tend not to have the sexual side effects. We make something called serotonin mood support, 5-HTP, inositol, and the spice saffron. So there's actually about 12 studies now with saffron, comparing it head-to-head with Prozac, Zoloft, and imipramine, showing it's helpful for depression, also shown to be helpful for PMS, and was shown to enhance memory. There's also the supplements tryptophan and St. John's wort. We'll talk more about St. John's wort. It's a little trickier to use because it induces liver enzymes and can actually decrease some medications, the effectiveness of some medications, like birth control pills. So that could be a problem. And you go to the health food store, get St. John's wort because you're feeling depressed, and now all of a sudden when you're pregnant, when you didn't want to be, could be a problem. The next 2 parts of the brain are really important and really interesting. They're the basal ganglia and the insular cortex. So the caudate, so the arrow is pointing to the head of the caudate nucleus, is involved in thoughts. It's a really interesting part of the brain. The basal ganglia and insula together, movement, anxiety, and motivation. The putamen, more motor movement. The nucleus accumbens, just lower to that, is the little pleasure button in the brain that responds to cocaine or your own internal pleasure. The insular cortex is just lateral to the basal ganglia. So if we look here, so here's the caudate, putamen, and then just lateral here is the insular cortex. And the insular cortex is divided into two parts. The anterior part is involved in emotional processing. When you're feeling angst, disgust, pain, that really fires up. The posterior insular cortex is involved in processing sights and sounds. And that's active in a term that I want you to pay attention to later called the Irlen syndrome. It's a visual processing problem that is really important and interesting. So when we look at the basal ganglia and the insular cortex, movement, anxiety, motivation. The basal ganglia blend feeling and movement, which is why you jump when you get excited or freeze when you get scared. Controls the body's idle. Just think of Parkinson's disease. When Parkinson's kills the basal ganglia, people can't move and they get depressed. It's involved with motivation, helps to control smooth motor movement like handwriting. The insular cortex senses emotional and physical pain. So when there are problems in this part of the brain, when they work too hard, people can be anxious and have feelings of panic. They tend to avoid conflict. They predict the worst. They might have too much motivation. Every time I've scanned myself, my basal ganglia always work too hard. And I used to be really anxious. The insular cortex is involved with pain. When the basal ganglia are too low, so ADD-like symptoms, been shown to be low in ADD, decreased motivation and movement disorders. So you need some anxiety. We've talked about this a couple of times already. People with low levels of anxiety, and the same guy who studied the people with antisocial personality disorder, Adrian Raine, showed they had 10% less volume. Well, he's also showed that people who have lower sweat gland activity and slower heart rates also are more likely to go to jail. So you need some anxiety. So you don't get into trouble, make bad decisions, get arrested, involved in risky behavior. Low levels of anxiety cause you to underestimate risk. And we often see that in our patients that are overweight or obese. It's like always tomorrow they're going to get well, not now. They don't have that sense of I got to do it now. One of my patients with panic disorder with focal hotspot in her right basal ganglia. The right basal ganglia tends to be more involved with internal anxiety, and the studies of OCD, it's either cingulate gyrus and or right basal ganglia. This is a very important picture. It's someone who has post-traumatic stress disorder, and what we typically see is the diamond. So you can see on the image, you can see this diamond. So at the top of the diamond is the anterior cingulate. The bottom of the diamond is the thalamus. And then both sides are the basal ganglia and insular cortex. When you see that diamond, and then you see increased activity in the right lateral temporal lobe. So here is the cingulate, thalamus, basal ganglia, insular. So connect the dots, looks like a diamond, and then right lateral temporal lobe. This is the pattern we typically see with people who've had emotional trauma. It's like their limbic brain becomes inflamed. So here's looking at the basal ganglia in a healthy person, someone with Parkinson's, before they're treated and then after they're treated. You can see how the basal ganglia is healthy on the top one, really low in the middle one, and better on the bottom one. So when the basal ganglia are too low, so motor disorders like Parkinson's, Huntington's, EPS symptoms. So when we give dopamine blockers, it's lowering activity in that part of the brain. Nora Volkow, who's the head of the National Institute of Drug Abuse, she's actually published studies taking cocaine, tagging it to a radioisotope and go, where does it work? Basal ganglia. And then she tagged Ritalin. And it's like, well, where does Ritalin work? Basal ganglia. One is highly addictive, cocaine. Ritalin is not highly addictive, having prescribed it tens of thousands of times. The biggest problem I have with Ritalin in teenagers is getting them to take it. And if you overdose them, what happens is they get spacey and tired. I've never had a problem with it, people acting in an addictive way with it. But one of the reasons cocaine is addictive, it's in and out very fast, where Ritalin stays, it's there much longer. Low motivation when the basal ganglia are low, and people have apathy. When it's too high, panic, anxiety, somatoform disorders, so they feel their bodies a lot. Tourette syndrome has been shown to be associated with basal ganglia activity, and PTSD. So what do? You have someone with high basal ganglia activity, so think relaxation, hypnosis was actually one of my favorite techniques, meditation, cognitive therapy has been found to be helpful, balanced fish oil, and then calming meds or supplements. So from a medicine standpoint, Buspar can be helpful. I don't use benzos. I don't like them. They're more trouble than they're worth, and they make your brain look like you're a drinker. So that's why the unhappy faces. When I have somebody that's anxious, I tend to use anticonvulsants. If I'm going to use medications, I tend to use Neurontin for anxiety, pain, and irritability. I use Lamictal and Depakote if I think they have a bipolar spectrum. I use Lamictal for some cases of resistant depression. For performance anxiety, I might use propranolol. But what I've found over the last 10 years is I can get just as good a results with supplements, especially magnesium. 80% of the population is low in magnesium, and you know when you're doing cardiology that they use magnesium a lot because it decreases heart arrhythmias. It's stabilizing nerve cell firing. So I like magnesium taurate or magnesium glycinate. Relora is a special supplement that blocks cortisol production. Holy basil is an adaptogen, been shown to have relaxing properties. And theanine from green tea helps you focus and calm at the same time. We put the ones in green into our everyday stress formula, one of my favorite formulas. We also might use GABA or valerian or kava kava. Kava kava actually has A-level scientific evidence for anxiety. I tend not to use much of it. There was some issue about liver problems with it a number of years ago. Okay, next system, temporal lobes, incredibly important, so awesome and important, and a very large part of the brain, and psychiatrists hardly think about it. The lateral aspect of your temporal lobes are involved with auditory processing. The medial aspect is involved with memory and emotional reactions. The underside is involved with visual processing and facial recognition. So the temporal lobes are called the what pathway in the brain, W-H-A-T, because it names things. The temporal lobe is one of the first areas that die in Alzheimer's disease, which is why she's been your mother your whole life and now she doesn't recognize you because that part of the brain is dying. So the temporal lobes in general, they're involved with language, memory, mood stability, temper control, listening and reading on the left side for most right-handed people, and reading social cues on the right side. So people who have dyslexia, typically it tends to be left temporal lobe. People who have nonverbal learning disabilities tends to be right side. So nonverbal learning disabilities, these are people that just don't get social interactions. They can't read other people well. The temporal lobes, especially on the right, are involved in rhythm and music and spiritual experience. There's this fascinating group of studies out of Canada where Michael Persinger, he's a psychologist, would put these helmets on people that would give them low volt electrical activity. When they'd stimulate the outside of the right temporal lobe, people would have a sensed presence, or they would feel the presence of God in the room, which I just thought was really interesting. And there's actually 22 cases in the literature of orgasmic epilepsy, which is so people, before they have a seizure, get washed with a feeling of having an orgasm. 17 of the 22 are on the right side, which I'm like, orgasm, spirituality, that's why she cries, "Oh God," when you make her happy. So it's a spiritual experience. But temporal lobes are just fascinating and often abnormal. Lots and lots of published studies with schizophrenia with the temporal lobes being abnormal. As a group, when they're abnormal, now the temporal lobes sit right behind a very sharp bony ridge called the lesser wing of the sphenoid bone that sits right in front of the amygdala. It's like God should have put bumper guards on that ridge, because the amygdala frequently gets hurt in traumatic brain injury, which is why you often see the football players killing themselves and killing other people, because that area becomes repeatedly damaged. When there's trouble in the temporal lobes, emotional instability, memory problems, feelings of panic that can just come out of the blue for little or no reason, aggression, especially the left side, headaches, learning problems. They can have visual processing problems like illusions or déjà vu. They can have other illusions like the smell of burning rubber. They can hear sounds that aren't there, but they're not like schizophrenic hallucinations, they're illusions. So they might hear the sound of bees buzzing, or the sound of static from a radio, but there are no bees and there are no radio. So it's very important. If people say, "I hear things," don't just diagnose them as having schizophrenia. Go, "I want to hear about it. When did it start? Tell me about it." One of my patients who's got a temporal lobe dysrhythmia, that's what we call it, hears the sound of machine gun fire. There are no machine guns. They tend to have mild paranoia, so not frank paranoia like the Russians are out to get them, but they have the sense maybe people are following them. And they have unusual religious or sexual experiences. When the temporal lobes are too low, learning problems, memory problems, several of the dementias, especially Alzheimer's disease and frontal temporal lobe dementia, can be low in epilepsy. In fact, this is how I discovered it. I had a boy who was attacking people for no reason. I scanned him, it's 1991. He has really asymmetric low left temporal lobe. And I went, "Well, what does that mean?" Because none of my training programs taught me what it meant. And it was associated with epilepsy. It's a classic SPECT imaging finding with epilepsy. When they're having a seizure, overactivity, but in between times in the interictal phase, low activity. I put him on Tegretol, all of a sudden all the bad violent episodes went away. He became like one of the sweetest kids. And I'm like, that's so exciting. Commonly low as an effect from head trauma. Just if you look at the temporal fossa, it's surrounded by sharp bones. When it's too high in activity, they can be having an active seizure disorder, can be associated with irritability, panic, mysticism, spiritual or religious experiences. I did the Dr. Oz show and we scanned the Long Island medium. So you know mediums, they channel the dead. There's actually a study done by my friend at the at Thomas Jefferson University, Andy Newberg. He did a study on 10 Brazilian mediums while they were channeling, activated the non-dominant temporal lobe. So when I scanned the Long Island medium while she was channeling, it activated her non-dominant temporal lobe. It's like so stinking interesting. Now, does that mean she's talking to the dead? I have no idea, but it means while she's in that state, that part of her brain becomes more active. So here's a patient of mine who has temporal lobe trauma. She had no loss of consciousness. Do you need to lose consciousness in order to have a bad brain injury? No. Well, she was outside of Oakland, she's sitting in her Volvo, and she gets rear-ended by an 18-wheel truck. And her head never hit anything. So the insurance company said, obviously, you're faking, you couldn't have a bad brain injury. But you know your brain sits in water in your skull, it's not attached. So if you get rear-ended by an 18-wheel truck, what's going on inside your skull? This is what's going on inside your skull. It can totally damage and go over the ridges and cause small blood vessel tears, shearing of axons, scar tissue. It can leave you with a lot of problems. And her brain obviously is very troubled, especially her left temporal lobe, which is where the arrow is pointing to, and the underside of the prefrontal cortex. So now what she has is dark thoughts, irritability, memory, learning, temper problems. And with her frontal lobes being hurt, now she has little ability to control the negative cognitions that she has. Because if you hurt your temporal lobe, but your frontal lobes stay relatively intact, you have those bad thoughts, but you don't have to act them out. So it often takes a combination of both of them. Here's a little boy, 6 years old. I wrote about him in Change Your Brain, Change Your Life. He is compulsive, so you can see his cingulate right here. And he's got temporal lobe problems. He's got a big focal hotspot in his lateral temporal lobe. And he used to see his mother's head get really big. It's called macropsia, where you got illusions of bigness. Or micropsia, then her head would get little tiny. And he used to smell burning rubber. Now, I met him because he lost a tooth. He was so excited about losing the tooth. The next day, he pulled out another one of his own teeth and got another $1. So now he has $2. The third day, his mother caught him wiggling his teeth, and she said, look, if you pull them out, the tooth fairy's not coming. But he knew she was lying because the tooth fairy already came out for him pulling out his own teeth. And he ended up pulling out 6 of his own teeth. That's what got him into my office. And yes, he had that compulsiveness, but it's also pretty weird. And you often get that weird behavior with temporal lobe, seizure-like phenomenon. We actually don't diagnose it as seizures. What we say is they have temporal lobe dysrhythmia. Their EEGs may or may not be normal. When the epilepsy is from the hippocampus or the amygdala, from the medial temporal lobes, the EEG is often normal. And not many people are doing nasal pharyngeal leads, where they actually put leads inside your nose to measure the temporal lobes, medial temporal lobes. This is one of my domestic violence patients. We tend to see a fair amount of domestic violence patients. And he just hated himself. This was before, and then his brain 2 years later, so much better, as his behavior was better. Alzheimer's disease, I've showed you this picture, 59-year-old woman. It's the back half of your brain. I mean, do this for me. Put your hands on your head, your thumbs in your ears. That's the pattern for Alzheimer's disease. It's bilateral, parietal, temporal lobe, hypoperfusion, along with posterior cingulate. And there are about 300 studies in the literature on this. They even have autopsy-confirmed studies. So they had the SPECT scan, they had the clinical diagnosis, they autopsy confirmed it with the beta amyloid plaques and the tau tangles. And this pattern is highly predictive of Alzheimer's disease. Now, not all patients diagnosed with Alzheimer's disease have this pattern. Some of them have enlarged ventricles, so they may have normal pressure hydrocephalus. Some of them look like they have an infection. So those are the people you can't just, because somebody else diagnosed them as Alzheimer's disease, that you accept the diagnosis. If it doesn't look like this, you need to work it up. And one of my famous cases, Kip Kinkle, he shot and killed his mom and dad in April 1998. And then he went to his high school and shot 25 people. Based on my work, they scanned him at Oregon Health Sciences University and sent me the scans as part of his trial. And for a 15-year-old, he had a very damaged brain, especially here in his left temporal lobe. It's the area of the amygdala. And he had low frontal lobe function. You remember Kluver-Bucy syndrome, right? Damage the bilateral amygdala. They get this sham rage. attack. There was no good reason for him to murder his mom and dad or to go shoot all those people. All these school shooters, somebody should be looking at their brains. I mean, it's just not rational behavior in any sense of the word. So how do you treat the temporal lobes? We like the ketogenic diet. There's a fair amount of research on the ketogenic diet. So think of the Atkins diet. You get rid of all the carbohydrates, or most of the carbohydrates. And there are about 70 studies, most of them from Johns Hopkins, shows it decreases seizure frequency. We've seen it help with behavior. Now, there may be meds or supplements we'll talk about, and then neurofeedback. We can actually put electrodes over, measure the activity, and then teach people to change abnormal electrical firing. It's pretty interesting. So now the meds or the supplements really are dependent on what's the problem we're seeing. So this is very important. And really the method is, here are the symptoms, here's the brain finding, here's the intervention. So if they have mood instability, irritability, temper problems, we think anticonvulsants. And they have low or high left temporal lobe or right temporal lobe. Okay, so mood instability, irritability, temper problems, and temporal lobe problems, we're using anticonvulsant. If, however, they have temporal lobe problems, but they're not moody at all, what they really have is memory and learning problems, we're going to use the acetylcholinesterase inhibitors, or Namenda, which is a glutamate modulator. On a supplement standpoint, if they have mood instability, irritability, temper problems, we're going to use GABA, B6, and fish oil. Also probably magnesium. But if that's not the issue really is learning and memory, then we're going to use ginkgo and vinpocetine. Both of those have been shown to help memory and boost blood flow to the brain. Acetyl-L-carnitine and huperzine A. Huperzine A is a Chinese moss extract that works just like Aricept, except it has fewer side effects and it's less expensive. And phosphatidylserine, which helps stabilize nerve cell membranes, which has been shown to help cognitive function. We put those things together along with N-acetylcysteine and alpha-lipoic acid in our brain and memory power boost formula. So I want you to be thinking system plus symptom clusters equals the targeted treatment. And what's happening in psychiatry today is it's like symptom clusters equals diagnosis equals treatment. What we're just adding is what's the underlying brain physiology. The deep limbic system, so let's go off to that, talk about that for a little bit. It's the medial thalamus, so that big egg-shaped structure left and right, deep side of the brain. It's also the amygdala, hippocampus, hypothalamus, cingulate, and inferior orbital prefrontal. So that's all part of the limbic brain. So if you think of that diamond in the brain, the limbic system, this is pointing to the medial thalamus, integrates and gates sensory information, sets your emotional tone, how happy or sad you are. It's involved with bonding, stores highly charged emotional memories. It's also involved with your sense of smell and how interested in sex you are. When the limbic brain works too hard, people tend to be sad, moody, negative, low motivation, more isolated, loss of libido, and there's a higher incidence of pain syndrome. So too low, people tend to be less reactive. Too high, depression, sometimes cyclic mood changes, pain, and sensory overload. So here's someone whose limbic system is really high, in addition basal ganglia, insular, a little bit of their cingulate. Here's someone with bipolar, where it's just the whole thing is active. So if you have somebody with a high limbic system, what do? Exercise, head-to-head with Zoloft, equally effective. Cognitive therapy, that's what we mean by feeding the ant-eater. Lavender, actually 2 studies published in the journal Lancet showed that lavender has antidepressant, anti-anxiety effects. Interpersonal psychotherapy, teaching people to get along better with others, has been shown to be helpful and has brain effects. Fish oil, this is really important. Higher in EPA if there's no cingulate involved. If there's a cingulate involved, then you want a balance between EPA and DHA. I think just a good rule of thumb, 60% EPA, 40% DHA. Fish oil, a study head-to-head from New Zealand, head-to-head with Prozac. 51% of the people on Prozac got better with major depression. 57% of the people on fish oil got better. I think it was 4 grams. When they combined them, it was like 88% of people got better. So here's an interesting slide, and this really explains the method. So if they have a high limbic system and they're depressed, and low prefrontal cortex, we use Wellbutrin. If they have a high limbic system and a high cingulate and low prefrontal, we'll use Effexor, because Effexor is the great balancer. Or we use Cymbalta. If it's high limbic, high cingulate, their prefrontal cortex is fine, we'll use an SSRI. So let me go over that again, because I know it's a little complicated. So they're depressed. All these people are depressed. One, the only finding, high limbic, low prefrontal, we use Wellbutrin because it's stimulating. The other one, high limbic, high cingulate, and low prefrontal, we need to balance both norepinephrine, dopamine, and serotonin. We use Effexor or Cymbalta. High limbic, high cingulate. Prefrontal's fine. We use an SSRI to calm their brain down. So it's either calm, balance, stimulate, based on what we see in the scans. For pain, medications we use are Cymbalta, Lyrica, Neurontin. Now, from a supplement standpoint, we use SAMe like we'd use Wellbutrin, except I would use Wellbutrin if they're also smoking. I would use SAMe if they have depression and pain, because there are about 40 studies with SAMe showing that it's helpful not only for depression, but it's also for pain. In fact, in a randomized, placebo-controlled trial on treatment-resistant depressed people from Harvard, 1,600 milligrams of SAMe broke out significantly from placebo, got a better response with SAMe. I like SAMe a lot. I use it and prescribe it a lot. If they have a high cingulate and low prefrontal, I use 5-HTP in SAMe. If it's just a high cingulate, high limbic, I'll use 5-HTP, or what I'll really use is our serotonin mood support. For pain, SAMe and fish oil. Anybody that's in pain, I use as much fish oil as I can get them to tolerate. And then the cerebellum, really interesting, completely disrespected. 10% of the brain's volume, it has 50% of the brain's neurons. So half of the neurons, and it's involved in processing and integration. It's involved in coordination, but also impulse control, organization, speed of thought, like clock speed on a computer. The left hemisphere of the cerebellum is connected to the right frontal lobe. The right hemisphere of the cerebellum is connected to the left frontal lobe. So you're going to learn a term called cross-cerebellar diaskesis. You damage the left frontal lobe, it actually turns off the right cerebellum. Isn't that interesting? It's just damage the right hemisphere, turn off the left cerebellum. Damage bilaterally, it'll turn off both of the cerebellum. It's really interesting. Typically on brain SPECT imaging using HMPAO or Serotec, that's the radiopharmaceutical we use. The cerebellum is the most active part of the brain, which totally makes sense given it has most of the brain's neurons or half the brain's neurons. But in certain conditions like autism and ADD and traumatic brain injury, you see it turned off. Really interesting. So when it's low, people have coordination problems. They may walk slow, think slow, talk slow. More commonly for us, they'll have problems with disorganization and be impulsive and have trouble learning. So here's actually someone where cerebellum was killed with a viral infection when they were 3 years old, and they walk slow, talk slow, thought slow. If you'd ask them a question, it would take them like 3 minutes to answer. With this person, we actually put them on Namenda, and it was when Namenda first came out, and it activated their frontal lobes and calmed down their cingulate. Namenda is a glutamate modulator. Glutamate, you know, is the most stimulating neurotransmitter, and actually calmed it down. So what we typically see in Asperger or autism is their frontal lobes are really active, cerebellum not very active. So here we're blue, red, and white. In a healthy scan, we'd see red and white in the cerebellum in the back part here. But that's really spotty, but really hyperfrontal. And the term hyperfrontal just means the frontal lobes are hyperactive. They're really active. Also, what we see in Asperger's is the cerebellum is low. And you often will see this shelf on the scans. So when I talk about the shelf, it's here. It's like the back half is really atrophied or shriveled. This is someone who thought they had ADD, read my book, Healing ADD, thought she tried all 6 of the stimulants for ADD. They didn't work. She goes, well, I must have a different type. I'll go see Dr. Amen. And when we scanned her, all of this is really low activity except for this spot here in her cerebellum. That was no activity. When the readers read the scans, we actually read all the slices, so we can see is that low activity or no activity. In that spot, it's no activity. She had a tumor the size of a lemon occupying her cerebellum. And Ritalin doesn't help tumors. Adderall's not good for tumors. When they took the tumor out, her whole brain increased in activity. So how do you help the cerebellum? We recommend this all the time. Coordination exercises, juggling, dancing, table tennis, stimulants can help. And one of the things we found is if you focus on what you hate about your life, your cerebellum drops, which is why people get into athletic slumps, because they become actually less coordinated when they're thinking about negativity. So on a group of supplements, I showed you that MMA fighter earlier. Well, his brain went from low cerebellar function to much healthier cerebellar function just by stimulating blood flow to his brain. And those are the systems. And it's these systems that we will use when we talk more about the method.